Hi, I'm Dr. Hart. I'm here with one of my youngest patients, Jaya,
Yeah.
who had surgery. How long has it been?
Almost 2 years now.
Almost 2 years for both of her hips. And she's going to tell us a little bit about her situation, her experience, hip replacements on both sides. So, Jaya, what happened? What was your kind of situation, and how did you end up finding me for surgery?
So the situation was that I was diagnosed with juvenile arthritis when I was 14. So I've been living with limitation and difficulties in the past years. But quickly, when the hospital called us to say that we needed a hip replacement, I was doing a bit of research and they told me that it took up to 2 to 5 years to have a hip replacement in the public side. So that's when we decided to go private, and we looked the best orthopedic surgeon in Montreal, and then Dr. Hart appeared on the first page there. So I actually got the name of this clinic here, and I contacted, and they made me filled up a questionnaire, and then I think 2 hours after you called me and you were questioning about my health conditions and everything, and you gave me an appointment 2 days after that, which I
Pretty
thought,
fast.
which was pretty fast, because at the hospital I've been waiting for like 6 months to have just the first appointment with an orthopedic doctor. So I actually came with my mom here at first, and we were really surprised on how quick and efficient, and all the staff here was so amazing.
I mean, I work on the public side too,
Yeah.
and I do about 80 complex and revision cases a year. But the big limitation there is having access to the operating room, and it's quite frustrating because the response I have from my hospital is see less patients. It's not here we'll give you additional resources. That's the bottleneck. Whereas here at Ortho Westmount, we have essentially unlimited access to the operating room. And it means that we can see patients quickly, and we can operate. I mean, we operate on weekends, so we operate two rooms when we have two full teams. So it's that's the big difference. What were your limitations? Because I remember seeing you, this young lady walk into the office, and it's like, oh, she shouldn't be here. And then I see you walking. You were limping. You could barely walk. Yeah.
Exactly. Well, I was using a walker for the past 2 months now. So my back was pretty arched into the walker, and I could not even put any weight on my right leg. I remember that you were looking at
Manipulating
everything
you.
and you were like, okay, you're not putting any weight on your right one. That's something that I was like concerned, because I was feeling more pain into my left hip, but I guess my body was just compensating.
So, what impact did your arthritis have in terms of your day-to-day functioning? I think you were working at that time at a cafe. How significant was your disability?
Well, very significant, sorry, as I was not able to go out of my home alone. I had someone to bring down the walker because I had a lot of stairs at home. So like the groceries, I couldn't do alone. When the doctor told me that I needed a hip replacement at the public, that's when I decided to say, okay, the job has to go away.
And let's do it quickly.
And let's do it quickly, because it was very intense. The pain was very there all the time, but not able to dress myself, like pants and socks, not able to shower myself alone. Even using the restroom, sometimes it's difficult. So there was a lot of limitation.
I remember at the time you actually did a GoFundMe, and your friends, family, and the community was very supportive, and kind of seeing how bad a situation it was. So you were able to raise enough money to actually do the surgery?
Yes, that's very awesome. We were very surprised because when we came here, actually, we discussed with you and your fabulous surgical coordinator, Francie, that we didn't have all the funds that we needed to be able to afford a private surgery. So my mom was like, well, we're just gonna find a way, And we had a lot of messages from Ontario patients as well that were looking to have surgery in the private. It's crazy because I feel before I didn't know that there's this whole community of patients that need hip replacement or knee replacement, and I felt very listened, and that was a very, very nice experience in a way. to say.
How are you doing now? How has your recovery been? You're, like you said, almost 2 years
Yeah.
from surgery. How are things going now?
It's been going amazing. I don't think I can be more grateful than this, honestly. I can go to the gym, I can walk without having pain. That's one of the most amazing thing. I think I can walk a few blocks without complaining, so that's amazing. I can dress myself alone. I have my own autonomy now. Like I feel like I can do my stuff alone. So that's being fantastic for me. But 2 years, in March 16th, it's gonna be 2 years now. And I feel like the first year was a bit more hard. It was harder for me because I didn't know like the limitation, how much can I walk per day, how many exercises.
Whether you're overdoing it
Exactly,
or not. Yeah.
because I didn't want a setback. And I was being very careful about this, but now after 2 years, I can say that I'm not even thinking about a limitation because I don't really have any.
And we usually tell patients that the more you use your hips, actually, the better they're going to function. You're going to work the muscles, get stronger. So I'm glad you've had such a good recovery and that you're doing things that you should normally be doing.
Exactly, especially at my age. I feel like I got the surgery when I was 24, so that was limiting my social life, work, even just like alone with your thoughts. Sometimes it was very hard with that much pain. So it really, really changed my life.
Yeah, it's a great surgery. So one thing, maybe we'll just share it too, is that you then decided to get involved and help other patients explore private surgery.
Yeah.
So maybe just say a little bit how, Jai has actually joined our organization at Ortho Westmount as a surgical coordinator.
That's right. I was looking for a job after I quit the cafe and my rehabilitation. I wasn't sure how much how much hours per day I could stand on my feet. So all the restoration and cafe, I've let it behind. I was looking for more an administrative job. So I came here actually for my follow-up, which was about 6 weeks after the surgery. And there was no one sitting at reception. And I thought that was a great way to ask if they needed help, And I saw Francie was sitting at reception, which I thought was not normal because she's a surgical coordinator, right? So I asked Francie and she told me, yes, we're actually looking for people. So I sent her my CV and
we jumped on that opportunity because it's been great because having been through the experience, when patients ask questions about surgery, there's a lot of questions.
Yes.
Having firsthand knowledge has been really key. So.
Yeah. No,
we're lucky to have it.
It's a different knowledge. I don't have any medical training, not any administrative studies. So that's for me, it's a new world here, but I really enjoy it. And I feel like people here at Ortho Westmount Clinic helped me so much that when I came back, I wanted to be able to, they helped me. So
that's great.
So now it's been almost a year that I'm a surgical coordinator. And very proud of it. And I just don't coordinate your surgery, but that's another thing.
I need to get you onto my team. I've requested so many times.
I know, but I used to schedule your follows up, but now it's limited. But still, I'm still here. We see each other all the time. So that's.
Jaya, thank you so much for coming in and sharing your story. And I'm happy you're doing so well.
Thank you very much, Dr. Hart.